Hello, everyone, and welcome back to Mic Check. We are missing Miss Rachel, but I'm going to step in and be her today and myself. So Rachel is here in spirit, and me, I'm Aja.
And I'm Sean.
And we have a very special guest.
The guest.
The guest. Capital letters. The guest. The one and only Mr. CEO, Mr. Rodney Goodie. And he is going to be talking about a very special project that is near and dear to his heart. So let's just jump in.
Let's jump in it. Now, wait, before we jump in it, for the people that haven't seen your face on a previous podcast, could you tell us a little bit about yourself?
Hi, I'm Rodney Goodie. I'm the CEO of St. Hope. I've been here since inception, and it's now approaching 25 years. And so super excited to serve the community, super excited about talking to y'all. This is episode 36, and so super proud of Mic Check 2, and happy Pride Month as well. And so I'm glad to be here. So ask questions and I'll answer.
All right. So now we'll jump into it. So with it being coming into our 24th anniversary, going into 25 years, you've been doing a lot of expansions. I know you've seen expansion at the Bel Air location. You've seen expansion at the Sugar Land location. But we want to talk about another location that's near and dear to your heart, our Greenspoint location. So you want to break the news to everybody?
Yes, Greenspoint is set to have a grand opening in July. The 12th, we'll talk about it some more. And so it's about our new expansive, ultra-modern health center. It's going to have all these array of services to serve the community. So it's a really exciting time. It's been 1,231 days since the concept of it. So there's been a lot of stuff that's happened in that time, COVID, and then just things that we've gone through to get to this point. But we're so excited about being here.
Right. So this was supposed to happen way back when, but like you said, COVID happened and then pushed everything back. But we're excited. Tell us about Greenspoint. Pretty much like what was it before and where did you see it as originally when you were thinking of the concept?
Yes, when we wrote the grant for FQHC to become a federally qualified health center, our main location was the Greenspoint location. And at that time, Greenspoint probably was about 38% Caucasian and a little under 30%, and then majority, the rest are people of color, Black, Latino. And so there was a great need there because there really wasn't any healthcare services around. So we really went looking for a building. And so we found this building, and it's about 50,000 square feet, and they were leasing out 11,000 square feet for us. And so that was a call center. There's nothing in there. It was just an open space. And so we built it from the ground up for the Adult Primary Care Center. And that was about 2015. And then later on, close to 2021, we purchased the building. So we convinced the owner to sell it to us, and we purchased it outright. And then there began the concept of what do we do with all this additional space? So Greenspoint is probably about a 12 square foot mile area in Houston, the northern part of Houston, and some people call it Guns Point, but we're going to reframe it today because we really see this new health center being a beacon for the community. Like, there's so many people that need the healthcare services, and so I think this location is really going to continue to grow exponentially. As far as number of patients we see a year, they're the second largest number of patients that we see behind Bel Air. So that they're really doing good.
Super busy.
Sugar Land is close too.
Look, you see, I had to give him a side. For those that don't know, I'm from Sugar Land location, so I had to give him a quick side eye.
Yes.
But you know, Bel Air is still. Hi, we still reign supreme. Sorry, guys.
Anyway. But no, that's good. No, when you say it's important to the community and they're going to be expanding, there's not a lot of health centers out in that area. So and I know they're doing a lot of expansion, like especially with the mall, they're going to be making it like a housing unit. I read,
Right.
so that is actually going to be a great opportunity for St. Hope to expand because you're going to have people moving in. They're going to be looking for quality healthcare services, and Greenspoint Mall is literally on the other side of the freeway, so that's barely a walk over. So.
Right. Right. And that's true. I mean, it's like it's an area where it's just a high need. You don't really have many providers. And, one of the services we'll talk about is pediatrics, is the need for pediatric services in that area is critical. I think Texas Children's Hospital had a site that they end up closing not too far from there, trying to serve that area. But we are really the safety net for the Greenspoint area as far as providing health care for people that are insured and uninsured. And we serve a lot of patients who don't have insurance, who've fallen out of coverage, and they're just looking for somewhere to go.
So I know we've done expansions before. How has the Greenspoint expansion been a little different? Any lessons learned, setbacks?
Well, I will start off by saying that the lesson I learned is to slow my timetable down. So in 2021, we did the draft of the facility. We were like, oh, by 2022, into 2022, it'll be done. And then I was getting in front of the staff saying, oh yeah, our center's gonna be done any minute. And then the next time we would have staff meeting, I was like, okay, there's a delay. And I came back and said there's another delay. And then staff just started looking at me like, yeah, right. So they start doubting that Greenspoint would ever get done. He's just talking. He's just blowing smoke up our, what. And so I felt, the timeline that I was expecting, really the move of it, because even when we thought we would be done in 2023, it kept moving. And it's just various things. It's like either the contractor had to go and get the city to give a permit for this or something specific that's changed. Or when we started digging in the foundation, we found out, oh, this has to be fixed because it's no longer viable. And so all those shifts, just like, wow, we're here 3 years, a little over 3 years, and finally you see, where it's at the final completion. So that was a real lesson for me. How is Greenspoint different from the other health centers? We really try to make it one-stop shop where you can do all the services. So it will have those components, but more services for specific populations. So pediatrics medical, pediatrics dental, and pediatrics vision. So it's really like when you think about pediatric care, people are having to go to 3 different locations for that, and they can get it all at one location. They don't have to complete 3 different registrations. Once they're in, they can actually go there and do it. So that's unique. We have not seen that before as far as community health centers in the Houston area, and so we're excited about that. The other pieces is we also have imaging. So we have a whole diagnostic center. So we refer a lot of patients prior to us starting ultrasounds, mammography, and CT scans. We were referring a lot of people out to Memorial Hermann to actually get this done. But we found that a lot of the patients didn't go. They missed their appointments for various reasons. The self-pay patients didn't go because the bill was too high. And so bringing it in-house and actually investing and putting the investment into the infrastructure to have this diagnostic equipment and train professionals to do it really is a win-win for patients. And so that was something that we brought in, and then also prosthodontics for the dental program. So we send cases out, for people for dentures. We do a lot of dentures at St. Hope. So, but sending cases out, it would take at least 60 to 90 days for those cases to come back. By having it in-house, we've cut the middleman out. And so we actually can turn cases around in 2 weeks or maybe less. So it'll actually make it much more faster. So, people can get the benefit of the services quicker than actually waiting through the normal process. So those are some of the things. The other big thing about Greenspoint is the event center. So the event center was necessary for us from a business standpoint, and it's necessary, I think, for the community. It was necessary for us because we were meeting outside. We didn't have a facility that could hold 200 employees. And so we were meeting outside of our walls. And so this facility actually will hold 450 sitting at a table in the space. And so we'll be able to conduct our staff meetings, but we also will lease the space out for events. And
I was just about to ask you, where
Yeah.
you're going to be able to...
Yes. And so it's state of the art. I mean, we've really just changed that whole look over there. Once you walk through the grand opening, you'll just be amazed because it's like, I don't know how to describe it. It's kind of like when you go to these, it's not a church, but you know how you go to these unconventional churches now where they really are creative in color and setup and design. And so it looks like that and has all the digital work in it as far as being able to perform meetings or have weddings or have events, business meetings, or even just anything that you want to do, that you'll sign a contract and make sure that you are keeping our place and facility safe. So, but I think in the Greenspoint area, the need for the community, there's so many people that need place to have a wedding and they can't afford a hotel. So here's another alternative for them. But strategically for us is to use it for our big meetings, and we can even host meetings for other funding sources who needs places to meet. And so it's really it's a beautiful place. I want you to see it in person. We're super excited, but this is something that we worked on hard and really got it nailed down. So it looks really good.
So now with the media center, are there any other special amenities that could be included going into Greenspoint that not just patients, but even potential clients that may want to use the event center that are going to be, what can we look forward to?
Yeah, it also has, the event center also has a kitchen area for catering to bring food in. So it's a full kitchen laid out for them to actually set up. So it's able to host an event as well as cater with the inside of it. As far as the lighting is state of the art as far as what we put in there. So it can accommodate any type of event. We don't have to bring someone in to do lighting and stuff like that. It's already pre-built into it. The sound system is state of the art. And then it's just amazing when you see it in person.
And you look so happy when you talk about it. I do have a question. As the CEO, I know you're excited because you're seeing your business grow. So you've just taken on just like the Dickinson location, but now you're expanding Greenspoint. How does it make you feel just as a CEO seeing what you came from back then when you first started? I know it's kind of a recycled thing that you get asked, but going into 24 years and now your second biggest clinic is getting a huge expansion. How does that make you feel on the inside? Just knowing this is your baby.
It makes me feel great. I mean, I'm very grateful. It puts me in a space of just being grateful because when you say your vision, I keep taking the Y off and saying our vision because it would not get to this point without the great people that work at St. Hope. So that makes me feel very inspired. Just like you say, 25 years, it's like you sit there and think, I remember walking through the event center about a month and a half ago, and they had started flushing in the walls, and you no longer saw the wires and stuff, but you start really seeing what it looks like. And I got emotional because I felt like, is this really happening? And so, to start something and do it from scratch and get it to a point and you go, you just have a spirit of gratitude. And so that's how I feel about it. That's why I'm excited. Did I have down moments during this 3 years? Yes. I had times when I went there and just was frustrated with the contractor, frustrated about the timelines, and really, it takes some effort to really keep your team moving in that direction and keeping them moved on, and just really making sure that you keep reaching for what you can't see, faith. It's like you reaching for something that, if you walk back to Greenspoint 2015 and what you're going to see next month, you're going to go, this is a whole new building.
So you're gonna do are you gonna post the before and after pictures of here's our clinic prior to?
Yes.
Boom. Okay.
Yes. The timeline will be there, so people can kind of sit there and go, wow. And so we really want it to be about the community. Greenspoint is such a important part of the Houston fabric, and so that's what we're really about. So really honing in on making sure that we offer quality services to the Greenspoint community. Yeah,
I'm excited. Because I haven't been to Greenspoint since 20.
Have you ever been to Greenspoint?
I've been twice.
No.
Okay, I've been twice. So I'm excited to see it.
Well, I'm glad you said that because we actually are going to close early on that day so that staff can come to the Greenspoint grand opening. They can wear their new fly 2025 t-shirts that they'll have and come out, and they don't have to work. All they have to do is just show up and mingle with people, have some refreshments and stuff like that.
But me and Asha just looked at each other
They
like,
look like,
They don't have to work. We don't have to work, but they don't have to.
You have to check any patients in. Well, the marketing is always
It's working.
It's always working. You're right, 24/7. But yes, we have a lot going on. So yes, definitely that's a day we're going to do that. Also, I wanted to say that we also are exploring a new part of it that's not really in our original design. Is we're going to carve up a podcast studio just for Mic Check 2.
Oh wow! Look,
So
Why wasn't this brought up?
You will have a new
Troy.
location, new layout, everything.
That's fun.
Oh.
That's exciting.
look,
So she'll be
Sean
at
can't take
Greenspoint
my
then.
spot anymore.
wow. Well, Rachel, you in trouble. No, I'm just playing. That's awesome.
That is.
We didn't know that.
Yeah, we did it. That's
I
what I'm
figured
They
like.
announced it on the fly, so that's why me and
I was
Asha looking
gonna
at each
tell
other like,
them
wait a
when we see it.
minute.
I'm like, okay, let me tell them what's coming. So yes, that's new. That's coming part of it.
Well, shout out to Troy
Yes,
for putting
Troy.
that in the atmosphere
Troy
for us.
has definitely spoken in my ear. He said, "What? Like he speaks like the Holy Spirit." So yeah, he spoke in my ear, and bam, it came into existence. But definitely, it's a beautiful campus. We're excited. We're repaving the parking lot, so the parking lot is going to be new. We redesigned the landscape, so the landscape it'll be a gated.
Oh, so it's not just going to be an interior. This is a
It's-
whole full on.
Full on. Yep. And so when you come in to the facility, we kind of are treating it where when you come inside the gates, the landscaping will be where you have walking paths to go and sit and relax and take a break, or take pictures if you have an event there on the event side, but really trying to make it an inviting space for people to come. So yeah.
I'm excited.
excited for that.
I keep saying that, but I really am. Because I can imagine it, but I think just seeing it
When you
is
see it,
going
it's going to be a different
yeah.
experience.
Right.
Now, are there any services that you would like to see St. Hope take on that we currently don't offer in the greater Houston area? Is there anything in your mind that's been processed? I'm sure there are. I already know you got like a million different ideas of what you would like to do. But what is something that you think off the top of your head you would like to see St. Hope take on in the future?
Honestly, I think anything that is a service that can be integrated into our existing health center that patients need, we will pursue. So if we see in our referral system, we refer a lot of patients out for this particular specialty or this service, it's something for us to explore and say, hey, how can we bring this in-house? How can we bring it closer to the patient where the patient can have access to the service with less hassle and they can get it at a very affordable rate? So I don't have one to specifically list for you at this time, but stay tuned.
The wheels are always turning.
They're always turning.
They're always turning.
He gave us a slide grand, so that means he's thinking of something. But stay tuned.
He's gonna plant the seed soon. Watch.
Yes.
So I know we've expanded at Bel Air. We're expanding Greenspoint.
Mm-hmm.
Any other places you're thinking about expanding?
We had a couple other locations that we were looking closely at. I think this project has consumed a lot of our effort and energy. Mm-hmm. And so once we get past it, you'll hear about, new stuff that's coming. Yeah, we never
stop.
Yes. Yes, we never stop growing. So the organization is committed to, expanding, growing, reaching beyond what we can imagine. And so, yes, definitely.
What's the answer for the people that are listening, people that are watching on our social media platforms? What is the anticipated grand opening date for the general public to come out just to take a look at everything?
July the 12th, from 12 to 2 p.m. It's open to the public. All they have to do is just RSVP from the website. We'll have it up there, and they're welcome to come out to the event. It's 2 hours. We'll have live music out there in the parking area. We'll have festivities for kids to do, to play on, along with just a tour of the facility. I think when people walk through it, those, we're going to invite people that's been in that building. It used to be Everest Institute, used to be there for a minute. So we still know those people, so we will invite them out so that they can go, wow, this is completely different than what we had over here. So, so it'll really be this wide open space on that day. So 12 to 2, July 12th, have to RSVP, and they can come on out. We'll have food and refreshments for that period of time, and we'll invite politicians out. So we hopefully somebody from the mayor's office, local government representatives, Congress people, women and men to come out and support us. Mm-hmm.
So July 12th.
July 12th.
Put it in your iPhone. Put it on your calendar.
Yes.
Mark your calendar. Circle
Maybe
it.
even will there be like an email blast as well, possibly?
Yes.
Okay.
Yes. Rachel's going to send out the email blast since she's not here, right, Rachel?
Check your email. Check your text messages.
We're going to be having a great time. And for people that don't know, like Mr. Goodie said earlier, we're going to be expanding the dental department as well as pediatrics, but we do offer full medical services. We have a pharmacy. We offer psychiatry. If you need any kind of therapy, case management.
Whoop.
And
shout out to Aja and the case management team.
You spoke on a service. You just made me think about something. I wanted to point out that with our pediatric, dental, and medical and vision, that our providers will be enrolled in CHIP. So a lot of people don't know that Texas Medicaid CHIP actually provides these 3 components to kids. And so they can get a free eye exam and a very discounted rate on their glasses. They can get dental care under CHIP. They can also receive, of course, medical care. So it's really meant to be a one-stop shop and make it really easy for folks to get in. And it's integrated, so it's not really. It's like when you come into the pediatric center, there are 2 lobbies. And so if you've not been to a pediatric center before, there's a sick child and well child segment to separate the kids. That's very common now. And so their routing and workflow is based on what side they come in. But the medical support team and the dental support team are kind of in the shared area. So they really are they're one team. They're close to each other. So it's really unique, and we're just really excited about it. And I forgot to mention that we have our digital designer is coming next week to actually do some original art. I'm not going to tell you what it is on the wall, and for accent walls to give it some color and pop for the pediatric, for kids to be excited.
Oh, that's going to be nice.
I know.
I love it. You have to pivot, and you've just been so adaptable, and just hearing you speak, you thought of all the little intricacies that were needed to make this happen. So July 12th.
July 12th.
July 12th.
Like you said before, Greenspoint's a huge area. Like, not even just Greenspoint, but that's the whole north side area, that Conroe, Humble, Greenspoint. There's a lot of families out there. So if you're needing any kind of child well care, even adults, this is going to be a great opportunity just to try to get people in to seek good health care, seek good dental. If you need eye care, need glasses, school's going to be starting in August, September. Yeah. You're going to be needing your eye exams, have your kids get new glasses, and with the Medicaid and the CHIP program going to be in effect, that's going to help a lot of people, especially in that area.
Yes.
So outside of what me and Aja have asked you already, for the people that are watching us, listening to us, even for people that are potentially looking for health care or dental care, eye care in that area, is there anything that we haven't brought up that you want to just throw out there for everybody?
No, I think the grand opening is really what I wanted to focus on here. We do have a 25th anniversary celebration later on in the year, but we'll save that. We'll talk about it actually at the grand opening. But yeah, no, it's just really about the Greenspoint area, the new ultra modern health center. It's really state of the art. The staff, some of them have actually snuck around and seen things and said, wow, this is nice. And we also are updating the existing clinic for the adult primary care. So we're going to actually make updates to that so that they don't feel left out. So
because the adults are going to like, wait a minute, the
Yeah,
kids
right.
get
They
this
go by.
whole new side.
Right.
We just have the same
we
area.
got these same walls. It doesn't change, So no, we're going to actually do updates there. So we're excited about that.
Okay, good. I'm
July
looking forward to
12th.
it. July 12th, 12 to 2. You can register online at offeringhope.org. And
You can also request your appointments there for any of our services. You can use the chat feature on the website to also ask any questions. Don't forget to give us a call at 713-778-1300 to set appointments. And remember, at St. Hope, you're more than just a number.